So, really, I would just love to start by kind of getting to know you a little bit more. We haven't really had a chance to talk, and I'd love to hear about your professional background and kind of what brought you to Compass.
Yeah, absolutely. So I am a licensed professional counselor, like by trade.
Mhm.
I have been in the field for, I want to say, about 13 to 15 years, and working in a PHP IOP level of care for, I would say, the majority of my career has been spent there. And specializing in starting off as a clinician, like specializing in working with individuals diagnosed with trauma, but also mood disorders and substance use disorders. And then over the past, I would say, 5 years, I've really spent a large majority of my time focused on clinical supervision and the development of clinicians and supporting their growth as new clinicians, but also clinicians that have been in the field for a while, and just providing not just consultation and case conceptualization, but also supporting well-being within the field of counseling. And so what interested me in Compass was really looking at like the values that the organization has, and thinking about this patient centered care being at the forefront of everything that Compass does, and being able to witness that Compass as a whole embraces the values that they have set in place. They still hold very true to patient centered care. And with that comes supporting clinicians, which I had just said is an important piece of the work that I do, being able to support an environment of clinicians and staff so that we can provide the best care possible to the individuals that are coming in every day for treatment.
It's amazing. Are you part of the Brookfield community? Do you live nearby?
Yeah, so I actually live so Brookfield is in Waukesha County. But what's nice about our location is we're really close to the Milwaukee County border. And so I'm just over the border in Milwaukee County area, around like the Tosa area, by the medical college.
Have you lived in Wisconsin your whole life?
No, no. So I was born in Wisconsin, but right before I turned 3, we moved to New York. And so I grew up on the East Coast. But I came back to Wisconsin because when my parents retired, they ended up coming back here. And then my husband and I started a family. And so we wanted to be close to family. And so that's how I ended up here in Wisconsin.
And so, what about opening up, you know, a new mental health center, Compass Brookfield, kind of close to home? What does it mean for you?
Yeah, I mean, I think it's really exciting opportunity for me, especially post pandemic. I have noticed that there is a gap in mental health care. And so there are a lot of wait lists for outpatient providers, prescribers, as well as our higher levels of care, from partial hospitalization to residential, and even at times struggling to find a bed on an inpatient unit for individuals who are experiencing a crisis. So for me, it really is an exciting opportunity to offer evidence based care, patient centered care for the community that needs it. We need another option. And so it's exciting to be able to bring this into the community that needs mental health treatment.
Yeah, and specifically that intermediate level of care is so important, as we both know, and not as many people as we would like know about it. So, can you kind of speak to that and really what makes PHPIOP kind of special for those who don't need inpatient or don't need a hospital visit, but need more than weekly outpatient support?
Yeah, absolutely. And great point. Not everybody understands or knows about PHPIOP, and so what is unique about this is that individuals who need more than once a week therapy appointment, they have the opportunity to come to Compass for PHP and spend approximately 6 hours a day, really being able to dive into skills that they may have been working on with their outpatient therapist that just didn't have enough time to process through, work through, and engage in. And so this gives individuals the opportunity to come in, learn these skills, go home into their environment and apply what they're learning, or experience, a difficult evening or an evening that actually like went well. They applied the skill, and engaged in maybe an event that they had been avoiding for a while. And now they get to come in the next day and work through maybe some of the bumps that they experienced, or share out with their peers and their treatment team how successful they were, in applying a skill or doing something that they've avoided for quite some time. And so so, really, the goal for us at Compass is to also support individuals who are experiencing more high acuity of symptoms, so suicidal ideation, self harm concerns, without having to step somebody up to an inpatient unit. And in fact, I would say around 88% of individuals that we see in our care have experienced suicidal ideations or self harm issues. And we've been able to treat that in a partial level of care without necessarily having to step up to an inpatient facility or residential level of care.
Yeah. And you mentioned that you've spent most of your career in this level of care. What about PHP and IOP is like why did you choose to focus here? Just from like a personal standpoint or just based on your experience, like what drew you to it? What kind
Yeah.
of keeps you coming back, I guess?
Yeah, yeah, good question. So starting off, like when I was practicing more as a clinician and seeing individuals every day, there is that piece about being able to work with somebody through these really difficult points of their life, seeing them on a daily basis. This 6 weeks can feel like a long time for individuals. For a clinician, I recognize that it's a small part of their journey, and I get to share that experience with them and see these, improvements that happen in a shorter amount of time. And I also really appreciate working with a treatment team. I like working with our psychiatric prescribers, registered nurse, all of the people that come around to wrap around an individual during their care, I think is really unique to a partial hospitalization program and an intensive outpatient program. And so I like being able to collaborate while watching an individual go through this journey of their care and see gains in their treatment.
Yeah. And since you brought it up, I would love to touch on those gains. And we know that the Compass model of care is proven. We have the data to back up what we're doing. It works. Can you speak a little bit to that? And how do we know that what we're doing works?
For example, when we have somebody who's in our mood and anxiety program, we'll ask them to take a PHQ-9, which assesses their levels of depression. And what we've seen is that individuals who come into our care experience, a 55% decrease in their depressive symptoms over the time that they're with us in a partial hospitalization.
And so, for someone who doesn't really understand how symptom reduction is measured, and maybe they think 55% doesn't sound like a lot. Well, I want to feel even more better. How would you kind of describe that to them?
Yeah, so that's a great question. We talk about, the time in treatment. So in partial hospitalization, these things take time. We ask, and I keep referring to 6 weeks. And so there are these markers for us that we will share with individuals that come into our care that the more time that they spend with us, so we say around 24 days in a partial hospitalization treatment, the more improvement they will see in, so for example, depression. I would say to somebody when they sit down in our care, and show them. We do have visualizations to show to walk us through. We call it the recovery curve, and we share with individuals, hey, look, like we know that if you're with us for 14 days, your depression will decrease by, we'll say, like 30%, right? But if you look and see, like from our outcomes, individuals who are in our care in partial hospitalization for 24 days, you'll see that the symptoms of depression will decrease even more. And so we explain it from a lens of like we have the sweet spot for days in care, and it seems like a lot of time to give. And we know that if you're with us for at least 24 days in partial hospitalization, rates of depression, anxiety, also if we're looking at OCD symptoms, those start to come down significantly versus if you're in our care for 2 weeks.
It's really good to understand. What I know, obviously, everyone's symptoms feel different for that individual, but as a generalization, what would that feel like for someone to have their symptoms of, say, depression reduced by 55%? What can that like look, if you had to explain it to someone, what could that look like for their life?
So I really like to look at that from a lens of like, what are your values? What are things that you value? And maybe you haven't been moving towards those values because of the depression that you've been experiencing or your anxiety. And so that could start to look like, maybe getting 1 extra hour of sleep. Or if I've been avoiding or struggling with like basic hygiene, brushing my teeth, taking a shower. Like maybe that's, I'm now able to shower twice a week versus not being able to shower when I came into treatment. It might look like being able to spend time with a loved one and, going out and seeing my family members again or reading a book, something that I just haven't been able to do that I enjoy doing because of my depressive symptoms.
That's really helpful. You touched on a little bit earlier, kind of the mental health challenges that you're seeing in Wisconsin right now. You touched on like long wait lists, limited access to, this type of care that we provide at Compass. And I'm curious, why do you feel Compass's model of care is, well suited to handle the challenges that folks in Wisconsin are facing right now?
Yeah. Yeah, that's a great question. So I would say from the time it starts with the beginning of someone's experience with Compass, from the time that somebody decides to make that call or submit an inquiry on our website, they're going to get a response real like quickly, like really quickly. And that's what we pride ourselves in is being able to connect with individuals and give them a response in regards to getting into PHP IOP in a rapid amount of time. And some individuals who have reached out for care may have experienced a longer callback time or a longer wait time to get into programming. And so, from the beginning, Compass really values being able to give a response to an individual that they can start treatment. And typically, it could be within a day. They reach out and they have an assessment, and then they're in our doors. And so it starts right there in terms of getting somebody into care. And so I think that's really unique is that ability to get into care for both our adults and our adolescents that are seeking treatment and they're not on a wait list and experiencing an increase in symptoms. We know that within the state of Wisconsin, the suicide rate has increased significantly. And it's one of, the causes of death in the state of Wisconsin. And so it's critical for us to get people into care as soon as possible.
Could you kind of speak to why it is so, as a parent, as a clinician, as a leader at our site, why it's so important to get people in as quickly as possible, and kind of what the feeling of waiting can do to a family, to an individual that does have to wait, versus being able to be seen right away, and how that affects outcomes as well.
Yeah. I mean, thinking about being able to get into care right away and just I think even the quick response of like somebody on the Compass side of things being able to talk to somebody right away, it starts to increase hope. Like somebody's answering me, somebody's hearing me, and I can come into treatment. And so when we have people that are on wait lists, what we experience is, higher levels of anxiety. How long is this going to take? When are things going to get better? That could lead to feelings of hopelessness and helplessness if we're not getting care quickly. Navigating systems within the mental health care system can be overwhelming. And so the ability to make things streamlined and simple can significantly decrease anxiety, alleviate fears of like, how do I even get into treatment? How do I even get my child into the care that they need? What does this even mean? And so, kind of going back to what I was saying earlier about Compass, is making it a simple process where people understand that they can get treatment quickly and get answers in a rapid way where they're not like waiting. Well, what does this mean? Do I have to go to this program or will I need a referral before I can even start? And so I think like just being able to have a streamlined process can reduce that anxiety around seeking mental health care. It's a scary thing to do, to reach out and ask for help. And so we want to reduce the stigma around reaching out for help and we want to create and we want to make sure that people have access to care. And so thinking about that from a lens of a parent and having teenagers, it can be scary when your child is experiencing mental health symptoms and I want my children to have the best care and I want that for our community as well.
Yeah, absolutely. And could you speak to the other layer of that approach, the immediacy, but also our ability to provide highly specialized care? So often individuals are struggling with maybe multiple different types of symptoms, or diagnoses, or just, challenges in general. How is our approach unique in that sense?
Yeah. So, what I really appreciate about the Compass model is that we can address co occurring concerns or multiple issues that are that somebody we're treating is experiencing. So, what I mean by that is that if an individual has trauma diagnosis, they can come in and be treated and address their trauma diagnosis, but they can also go to our other groups that may offer skills that are more generalized to address depression or to address maybe interpersonal relationships. And so they don't have to complete one area of treatment before they can move on to the next area of treatment. Our care isn't siloed into specialty areas. If somebody has a diagnosis of OCD, they're going to get ERP treatment on a daily basis, but they're also going to be able to go to some of the groups that are more generalized that will help them with skills outside of their OCD diagnosis, or maybe tailor to meet the needs of somebody who's experiencing OCD and anxiety. And so, what that really means is that not only is an individual getting a good dose of skills outside of, say, a trauma program, for example, but it also means that they can start to go back to, maybe work or school without having to, again, like I said a couple minutes ago, complete one area of treatment. And then, okay, now we're going to have you go over here and do OCD now that you've gained some skills. So we really have this ability to provide several specialty care areas at the same time, which also reduces the amount of time that someone's in treatment.
Why is that so important that we are able to offer that?
I really think it comes down to that oftentimes individuals aren't experiencing one, I'll say, diagnosis. It's not something that they experience in a vacuum. And so if you think about trauma, for example, there is the diagnosis of trauma and the symptoms that come with that, but then also looking at how that affects somebody's mood and their ability to engage with, if I went back to like what I was saying earlier about their values, and engage with things in the community, interpersonal relationships. And so being able to go into these other groups and learn about interpersonal effectiveness or learn about reconnecting with their values is just a great way to provide care. It really shows, back to your question, that people don't experience, for the most part, something in a silos. It's all encompassing. And so to be able to offer care that addresses individual needs versus just one diagnosis of or symptom of somebody is critical.
What would you say is one of the common misconceptions about like intermediate levels of care, PHP and IOP? What are some misconceptions that we have to kind of debunk?
I think kind of going back to what I was saying earlier, I think maybe there is a misconception that PHP IOP can't address higher acuity needs. So, like, we wouldn't be able to address somebody who has been experiencing suicidal ideation, whether that's acute or chronic. Same with self harm or substance use. So, PHP IOP, when it's done correctly, can absolutely address those things. I think, not necessarily a misconception, but a fear is that it's going to take a lot of time. People, especially when they're experiencing mental health concerns, might not feel like they have the time or ability to balance PHP or IOP. I can speak for the team here at Compass. We work really hard to work with an individual to not only validate that concern, but ensure that they have things in place so that they can focus on treatment. So, what I mean by that is, like, if somebody needs help with FMLA paperwork, we're going to help them with that. If they need short term disability to extend beyond FMLA, we're going to help them with that. We're problem solve and navigate through the time that we're here in treatment. So we want people to know that you can feel comfortable coming into PHP and know that there is a treatment team here that will help you navigate stepping away from your responsibilities and obligations for the time that it takes to complete treatment.
I think that that is so important for people to hear. So thank you for speaking to that. And it kind of segues into my next question. How do you feel Compass differs from other providers of PHP, IOP in the area, or like intermediate levels of care in the area? How does Compass stand out to you? You're helping open up, our new site. You chose Compass for a reason, and I would just love to hear more about from your perspective, how Compass is different.
Yeah, absolutely. So, kind of going back one, just quickly touching on the values of the organization, right? And so what we do is tailored to be patient centered. And so just starting with that alone, like saying again, like from the start of somebody reaching out to for services, that quick response is something that sets us apart from other PHP IOP organizations. That ability to speak with somebody right away, be assessed by a licensed therapist, and then also when they come into care, I will speak to, again, that idea of like we have the ability to treat multiple diagnoses at once the way our treatment team is set up. So, individuals will work with a primary therapist on their treatment team, as well as a family therapist. And so, to me, that really stands out as something unique to Compass is having a family therapist on a PHP IOP treatment team. Organizations within the area oftentimes will have the primary therapist also serve as a family therapist. And so I think that this is really special because family therapists are in family therapy for a reason. And so they're really able to speak to the needs of the individual in treatment, educate the family, and help support the patient through their care. And then we also have our psychiatric team. So that consists of either a psychiatrist or an APNP. And so individuals meet with them at twice a week and see them. And then we also have an RN that's on the team as well. And for our adolescents, we have an education specialist. And so what I think is really unique about our education specialist is that historically, for Compass, our education specialists do have backgrounds in education. They've worked in schools, and for whatever reason, they're making a switch into the mental health care field. And so, what makes that really special is that they can navigate school systems and really advocate for the adolescent that's in our care or the child that's in our care. Like, this is what we're working on. This is what they might need as they return to school. These are all the coping skills that are going to help benefit them. Yeah. And also, like, identify who those support people would be when they return to school. So they're also working with the schools to ensure that the adolescent has the work that they need. And so I talk about like schoolwork, homework, and then that gets added into our group in the morning that the adolescents go to, and they work on schoolwork with the education specialist so that they're not falling behind too much, whatever that looks like with the school that they're coming to us from. And so I think that's really something that is special to Compass and the care that the education specialist puts into the adolescents and helping them integrate back into school and make sure that they have the tools that they need to be successful upon return. Which, on kind of on a side note, I think like that as a parent myself can be a significant point of anxiety thinking about sending my child or my adolescent into treatment and wondering what that means for their academic well-being or their extracurricular activities. And so knowing that Compass has an education specialist that navigates through the schools, advocates for the adolescent, it would be a huge relief to me as a parent to know that.
Absolutely. What would you say to a parent or an individual, an adult, a young adult, unsure whether they need the PHP or IOP level of care? What would your advice be to them?
I absolutely would validate the reasons why they're feeling uncertain or unsure as to whether or not they need this level of care. I would absolutely talk through, I want people to give it a try. If they've been, if they reached out, there's a reason why. If they've been referred out from their outpatient therapist, there's a reason why. And so I want to see people give it a try. And our treatment team, including myself, we can certainly validate that the first week of PHP IOP can be overwhelming. It's a different setting. It might be something that somebody's not used to being in. And so validating the concerns, the hesitations, the fear, that's a priority of myself as well as the individuals that I work with. And, kind of going back to what you and I were talking about earlier, explaining like the benefits of PHP IOP and that again, it might seem like a long amount of time. And it's that idea of it sounds kind of cliche, but like, being able to take care of yourself before you can take care of others. It might feel like a long time to be in treatment and your symptoms may increase, right? Especially if you're being referred up to PHP IOP, and that may impede on your ability to continuously do your day-to-day activities, your job. If you have an adolescent, their ability to succeed in school. And so that can just compound over time, which may make the problem bigger, which unfortunately could lead to a need for residential care or being out of work for a longer period of time or inpatient stabilization. And so I just say, like, give PHP IOP a try, and we will work with you to get you the tools that you need to be successful and reduce your symptoms.
That's great. I would love to hear in your words if someone is unsure whether to go to the ER or bring their teen to the ER or to call Compass, how would you answer that?
Yeah. So I would answer that as if it's a psychiatric emergency, if the person is stating that they are suicidal in the moment and they cannot remain safe, or obviously if there is any like signs of self-harm injuries, we want them to go to the ER. If somebody is saying that they are having, an increase in symptoms and things just don't feel like they're getting better, or if they're struggling to complete their like daily task, feeling maybe like they're crying a little bit more than usual, I would say that that would be a time to to call Compass. So I guess like I would differentiate between if I'm like saying it again, if it's a psychiatric emergency in which somebody absolutely cannot keep themselves safe, and by safe I mean suicidal ideations, and there's a plan and intent, then certainly takes that individual to the ER. But if there, if it's other circumstances in which somebody is expressing an increase in symptoms, difficulties, completing their tasks, moving through daily life, we want them to reach out to us.
I think that'll be really helpful for a lot of folks to hear. And this to kind of bring it full circle, it sounds like nurturing your clinicians is really important to you as well. And our ability to provide the level of care that we provide in terms of that immediate access to care, the specialized programs, the environment that we have at Compass, nurturing our clinical culture and our clinicians is really important. So, could you just speak to what kind of clinical culture you're aiming to build at Compass and why it's so important to you?
Yeah, absolutely. So, at Compass, we want to ensure that like clinicians feel supported in their day-to-day functions and beyond that. Obviously, like every day we have roundings and the ability for clinicians to share out like where they might need help. So whether that's like somebody called in and I'm going to need help facilitating this group, or meeting with some of the patients that are here today. So we want to be able to provide support every day in like the basic needs of the clinic. Beyond that is supervision and consultation. And so that's really the space where our clinical staff can dig in a little bit more and have designated times to either sit in a group setting or with their supervisor, the clinical supervisor, to talk through where they might be feeling stuck, where they, might need some extra support with something that they're working on, a case that they're working on, but also like being able to share if they're experiencing burnout or compassion fatigue, and having a space in which they can talk through that and figure out like what additional supports they're going to need, which is really important in this line of work given how intense it can be, not just PHP and IOP, but in all levels of mental health care. And I think being able to create an environment that is also, I say, I'll say the word fun, because we like to do things like celebrate people's successes. Maybe they completed their license. That's a huge accomplishment in this field, is to get through those 3,000 hours and complete your license. Birthdays, milestones, or just like even just like a random like potluck celebration. The clinicians may plan like outings outside of the clinic as well. And so to be able to create an environment where they feel comfortable sharing difficulties, but also like being able to share in celebrations is really important, because we are experiencing a shortage in mental health care professionals. We are experiencing burnout, in which people came into this field and feel very passionate and still do, but it's not sustainable and they end up leaving the field. And so it's really important for me, as well as the other clinical supervisors that I'm working with, to create an environment that people feel welcome, they feel supported, and they also feel like they're creating community amongst the other clinicians, so that they have support in their day to day and outside of here.
Amazing. One final question. Is there anything that you wish that I had asked that I didn't, that you want to speak to, whether about yourself as a professional or personally, or just as a member of the community in general, or about Compass that I maybe forgot to ask?
Yeah, that's a great. One thing that I can think about is that we as Compass, like I'm thinking about the community, it's not just about the work that we're doing inside of the clinic and our daily delivery of treatment in PHP, IOP. It's really important for us to connect with the community and figure out what our collaborators need, what our schools need, what individuals in general need from us. And how can we support outside of PHP and IOP? And so that's really important is that we also want to be able to be a resource to the community at large outside of our daily treatment services.